So why is diabetes so scary? The reason of when a person is diagnosed with diabetes, it feels like the end of the world. Okay, but it is not actually uh, a thing that you get diabetes today, you will die tomorrow. It's not like that. But in fact, you will live a quite good years before you actually pass away. But why is it so scary when they say that when a doctor diagnose a person with diabetes? Because they usually will tell you once you get diabetes, you will have to take medication for the rest of your life. And most of the time, if you're 5 or 10 years of diabetic already, you will likely to be prescribed with insulin. So why is diabetes so scary? It is because of this problem. Our blood vessels in the body looks like a tree trunk. So this is the tree. This is the picture of the tree, and this is our blood vessels in our body. So the middle one will be the thickest, and then when it goes to the peripheries, where it goes to the side, and our hands and our feet, it will become thinner and smaller. So why does this narrowing happen? It is because when a person has high blood sugar inside the blood vessels, okay, the blood keep flowing with high blood sugar, it will cause the blood vessels to have inflammation over the walls of the blood vessels. So what happens when you have inflammation? Inflammation is just like our pimple. Okay, if one person have pimple, it will be yellowish. Okay, and then we will tend to go and pop it out. Okay? This thing will happen in the blood vessels, whereby in a very long run, in the long run, these blood vessels will get smaller and smaller, and after that, it will get blocked. So what happens? Of course, blood vessels is all over our body. What happens if the blood vessels in the brain get blocked? The person will get stroke. It's just like this man. Stroke. And then, okay, in fact, this man is quite lucky because he's still able to walk. But a lot of people, after facing stroke, he might not be able to stand up anymore. And I have patients sharing with me, his own father, unable to stand up and walk. For 10 years, he was bedridden until he passed away. For 10 years, he was unable to bathe himself. He needed pampers. He needed someone to feed him. He wasn't able to walk around. So that 10 years was really, really a suffering for his whole family, lah, okay, because he basically sees his dad suffer. And what happened if you lie down on the bed too long? Bed sore will happen. This just like this pressure sore. So this is not even a very bad sore to me. Yeah, I've seen worse wounds whereby I was able to see the backbone of the patient because I need to clean a lot of this kind of wound, just like how I have cleaned it, how I have cleaned the patient's left shin wound, okay, in the beginning of my presentation just now. So a lot of times, this wound is not only one, there are multiple wounds at a time, and we actually need to spend a lot of time in cleaning those wounds. And it's very sad because once a person gets stroke and he's bedridden, it's the quality of life just go down straight away. Okay? And this is a patient from Singapore.
Yep. This is a patient of mine from Singapore. She's 70 years old. And you can see that, you see, why do we say that we diagnose diabetes 10 years too late? You can see in this particular patient, she experienced a mild stroke back in 2000, the year 2000, with right hemiparesis, means right body-sided weakness. And at the same time, she was being told by the doctor, oh, Asoa, you actually have a diabetes and hypertension. Okay, meaning to say the complication happens, then only they realize that, whoa, okay, I'm actually diabetic and hypertensive. Yeah, so which is of course very sad. She also suffered from ACS here, acute coronary syndrome, meaning a heart attack. Okay, before she actually started seeing us. Yeah, so of course after seeing so many of these complications, the doctor decided to engage our service. Okay, so the mother is now under our care. Okay, she's in Singapore. She's under our care to help her to reverse her condition. You can see she's taking so many medications here. 10 tablets per day. All right. Okay, let's move on. Okay, we also have a patient from UK. Okay, this is my patient from UK, and she is recently diagnosed, actually March 2020. But when she was diagnosed, it was actually pretty bad. That's why she was actually on mixed start 20 units twice a day. That means straight away she was started on insulin, and because of course she just felt so bad with this insulin and all this. She decided to start the program, and within 2 months, I managed to switch off everything. Okay, that means she's now no more on medications, now no more on insulin. Right? Let's move on.
So what happens if the blood vessels inside the heart get blocked? This person will have heart attack. And we know that the incidence of heart attack is increasing in rate, and it's getting younger and younger. Just recently, of course, before the lockdown, I gone for hiking. Okay? And then there was one incident whereby it saddens me a lot. And that day was a very, very sad day to me, because when I descend from the mountain, there was one guy who lie on the floor. And then the paramedics was already there, taken the defibrillator to actually pump the heart. And when I reached that incident, the place of incident, I actually introduced myself as a doctor, and then anything I could help. But they say I have already pronounced it. Okay, so I actually didn't interrupt a lot because of the COVID also. And then I asked further questions. The patient is actually that particular man actually is just 50 years old, Chinese, a very big size, obese man, and then has underlying diabetes and also hypertension. And at that point of time, of course, we know that um, this patient is a very sad thing for the wife. Okay, the wife was at the side, crying, and then I still can remember his face until now. Okay, because the patient uh, was lying down there. His lips already turned blue, and then the eyes roll up. Okay, it's not closed. And don't think that if you are very active, you always go for hiking, you always do a lot of exercise, you won't get these complications. Okay, a lot of people just die on the spot, like playing badminton. We know, okay, some of them just die in the court itself, right? So I think Dr. Andrew has also this experience, right? Dr. Andrew, hello, hello,
Yes,
Dr.
I'm
Andrew,
here.
are
I'm
you
here.
around?
Yes, I'm here. All
Yeah.
right.
Do you guys have this kind of experience that you want to share?
No, I think because time is running out, I think we have to move on.
Right. So
Yeah.
we just move on from here. So this patient is Dr. Andrew's patient.
Yeah, this is real
Mm.
experience. This is our patient, Malay gentleman. So he did a stenting, okay, on 28th of April. That was when MCO already started. And you notice this is another similar case, diabetes diagnosed too late. So by the time he found out that he was diabetic, okay, he already had a heart attack, okay, and thank God, of course, he survived the heart attack. All right, so let's move on.
So we know that the diabetic patients, their kidney will also get affected. So this is just a picture of a patient undergoing dialysis, one in and one out, right? So Dr. Andrew has the license to open a dialysis center. So I actually want to pass the time to him to explain about this dialysis.
Yep. Right, it's true that I'm one of the very few doctors in Malaysia who owns a license to start a dialysis center. In fact, I'm taking care of about 30 dialysis patients at this moment. I have to see them once a month in the dialysis center. And to be very frank, it's a very depressing scene every time I see them, because dialysis is actually a full-time job. Why is it a full-time job? It's because you have to actually get yourself dialyzed 3 times a week. Okay, it's usually 135 or 246, and it's a very painful experience, not just for the patient but also for the caretaker. And of course, this is also a very expensive treatment. It's also a very expensive treatment. I'm not sure whether among the crowd, how many of you are aware how much does it cost to actually undergo a dialysis, okay, each round. Okay, can someone just put in a number, okay, if you know the answer, okay, please, or you probably just want to guess how much does it cost in Malaysia for you to have a dialysis done in, okay? And why do I say it's very depressing is because, you see, um, every 3 kidney failure patients, okay, every 3 year, 2 are actually either diabetic or a hypertensive, okay, which is of course very high. It's about, we are talking about even 60-70%. In fact, the last round when we did a talk, we had a dialysis nurse who are actually among us, and she told us that in her center it is 80%. That means 80% of the kidney failure patients are due to diabetes and hypertension. And so, why do I say it's very depressing is because last time when I first took my license for this, to me, I was like, it's okay, kidney failure anyway, it's just a part and parcel of diabetes and things like that. But nowadays, it feels very depressed because I know very well that kidney failure, right, can be prevented if you reverse your diabetes early. Okay, if you reverse your diabetes fast, reverse your diabetes early, you can prevent kidney failure. If you are taking medications or insulin, you can forget about preventing kidney failure. You are just a time bomb waiting for kidney failure to happen. Okay, so wow, we have so many answers here. All right, so we have some people say 280. Okay,
500 to
some
1.5
say
years. Oh God.
yeah. So 500 to 1.5K, 250 to 450. There's so many answers. Okay, all right. So to round up, actually the answers is about $300 each time. Okay, there's a range 200 plus to up to 300. So you think about it, one month, right? You need to go for 13 times. You multiply by 300 is about 3,009. Let's round up to 4,000. It's 4,000 ringgit per month. And if it's for a year, you multiply by 12 is 48,000. It's about 50,000 ringgit per year. If you live on, the patients whom I've seen that really live on, right, it's up to like 27 years. Let's say we don't want to talk 27 years, just say it's 20 years. 20 years, right? 20 years multiplied by 50,000, we are talking about 1 million ringgit here. Question, how many of us actually have 1 million ringgit in the first place? Okay, and even if you have it, do you want to spend it on this? Do you want to spend on dialysis? Do you want to undergo this kind of pain? All right, it's a full-time job. Yeah, all right. Someone say in Mandarin, "fu gui bing." Okay, it's a disease of the rich. It's so true. It's so true. Yeah, and just bear in mind, 4,000 ringgit doesn't even include the medications and some of the injections that the kidney failure patients require. Okay, just for information. Okay, let's move on. Okay, we have to rush a bit. Right. So this is the needle. It has to be big, yeah, obviously, because the needle has to be drained. The blood has to be drained out to the dialysis machine, and then of course drain it back. Okay, right. Yeah, very good. Someone said no, she doesn't want to. Yeah, they want to spend the money on holiday. Yeah, that's exactly right. You came to the right place because this is where we will help you to prevent kidney failure. All right. So I'll show you another patient of mine. Okay. So this is actually another failure. All right. This patient of mine, she's called a supplement queen. She's on 24 supplements when she saw me, okay, including protein shakes. So when she started the program, I told her, okay, you want to be good, you have to stop all your supplements. Your supplements have caused your problem to be where you are now, okay, so please stop. Okay, so on the 22nd of July, you can see that her HbA1c is 8.9%, which is still pretty high actually, yeah. And after started on the program, you realize in about 6 months time, her HbA1c not only didn't drop, it actually went up. I told you, okay, we mentioned that we want to be very truthful to you. We are going to share unsuccessful cases with you. This is just another unsuccessful case. Do you know why? I told her to switch off everything, but she refused to stop her protein shake. She was hiding away the protein shake from me. She was not telling me. Okay. And I'm not sure, ladies and gentlemen, how many of you here think that, protein shake is good actually, and how many of you are actually taking protein shake now, protein bars, and you've been told by all these salesmen, these MLM people that, carbohydrate is bad. A lot of people now know carbohydrate is bad, and fat is also bad. Fat is bad. Let's go for protein. Protein is good. Protein is good. If you are taking this protein now, please say yes. Please put a Y there. Let us know that, this patient of mine is not an alien. She's just another human beings, okay, being conned into taking all these protein shakes. If you are just one of them, please put a Y there, so at least we know you're taking this protein. Okay, so these people tell you, you must take protein shake in the morning, in the afternoon, in the for dinner and things like that, so you don't have to take other things. It's healthy. Really? Come on. Protein is good. Excess protein is not. Excess protein in our body is converted into sugar. into carbohydrates. So if you're still wondering how come you've been taking this protein shake for don't know how many donkey years and you realize that your diabetes is not recovering, it's not recovering, so it's not being reversed, now you probably know why. You see, we're sharing another secret with you. Do you think that these people who sell you these supplements, or do you think even the doctors will tell you that protein is being converted into sugar in your body? The excess protein, I mean? No, they will not. We have just shared the first secret to you whereby we diagnosed diabetes 10 years too late. You think the doctor will tell you that, oh, I'm so sorry, man, we are diagnosing diabetes 10 years too late. No, they will never tell you because it's like slapping themselves. Huh, doctor, you diagnosed diabetes and you know, and yet you are still doing it. Of course, they won't tell you. These are the secrets that the doctors won't tell you. This is one extra secrets. Excessive proteins are bad for you. Don't think that by taking all these protein shakes and protein bars or whatever, you can reverse your condition. You can't. All right. So stop wasting all these thousands and thousands of all these ringgit on all these supplements, which is completely useless. None of our patients are on any supplements in order to reverse their diabetes anyway. So you don't need any supplements for that matter. Okay. Let's move on. All right, we even have patients who are on kidney transplant, and of course, yeah. So we are also helping patients who have had kidney transplant to reverse their condition. Okay, I think we have to. Okay, our youngest patient is 27 years old, by the way. So if you're thinking that no lah, I'm still very young lah, I'm in my 20s. No, nowadays this diabetes hits very young patients. Okay, let's move on.
This patient is 28 years old and she was diagnosed with diabetes 3 years ago. HbA1c was 9.2. That means 25 years old, she started having diabetes already and she's on 3 medications, right? So she was also overweight that time, right? So we want to help her lah. And then moving on, the eldest patient is 83
Yeah,
years old.
our eldest patient is 83. So if you think that you are in your 70s or in your 80s that you can't reverse, no, not really. The question is, do you want to reverse or not? Do you want to regain your health or not? If you don't want, no one can help you. Okay. And of course, if you're not taking action, as we mentioned, information alone won't create change. Okay. So our eldest patient is 83. It can be done. The next complications that we're talking about is a diabetic wound. All right. So we know that many of these diabetic patients, after about 5 years, they start feeling the numbness over their feet, okay, especially at the toe area. And then because of the numbness, if they injure themselves, they won't know. And because of the lack of blood circulation, the wound won't recover. Okay, in Sweet Lives, we actually use a device called Sweet Hearts to improve the blood circulation in order to save the toe. Okay, and when we save the toe, we save the entire leg. We save the entire leg, we save the person's life. Because there are many people, when they lose their leg, they lose their life. Just like what Dr. Jasmine shared just now, what she's doing is because she saw how her patient lost his life just in a month's time. From the time he was admitted until he actually passed away was less than a month. Okay, leaving back the two very young children. Okay, let's move on. Yeah, this is another case of us. You can see that obviously this is gangrenous, the second toe, and in just about 5 months' time, we managed to reverse the condition and we managed to save his toe. Okay, so for those of you who are having this problem, okay, with this wound that you notice is not recovering, okay, you can PM us. Okay, you can PM our customer service, and okay, our customer service will brief you on this. Okay, let's move on.
So this is the leg with amputation, like what my patient has done, which is the below knee amputation and also the above hip amputation. Okay, below hip amputation, right? So amputation is a emergency surgery because once a person get the wound and then once the bacteria gets into the bone, it's called this condition called the chronic osteomyelitis, and it is a very uh, urgent surgery because the bone actually has got very good blood circulation, and if we don't amputate the leg straight away, it can go into the vital organs. Okay, that's why my patient passed away so quickly in 1 month's time after admission.
Yeah. Okay, all right. So this is how we use sweethearts to actually save this person's toe. Okay, all right. Let's move on. Let's move on. I think time
So
is
this
running
patient
short.
has numbness and also feeling thirsty and
Mm.
no longer numb and no longer thirsty lah. Okay, this is my patient. Okay, so just let's take a look of the complications of diabetes and how much does it cost actually if you have these complications. So this is just the price of the event year. So myocardial infarction is a person of having heart attack. Heart attack you need to spend so much, 20,000 ringgit, and then stroke is about it is 8,700. Heart failure, 5,000. Ischemic heart disease, ischemic heart disease is whereby the tissue inside the heart has already died off already. So it's about 4,000. Amputation is not free. Yeah? Cutting your leg away is not free. It's about 6,000 ringgit. Blindness, it's about 2,004. And then renal failure. Just now Dr. Andrew has shared renal failure about 42, and then not inclusive of those injections some more, and also blood tests. Diabetic foot ulcer, this 316 is only for one dressing. Yeah. And we have so many kinds of subsequent dressings, right? So the total cost over here during the event year, if okay, for the complications itself, total cost is 88,000. The question is 88,001 ringgit. You want to use it to treat complications, or you want to treat, or you will be more willing to reverse your diabetes.
Ladies and gentlemen, as a diabetic, you have to understand that you like it or not, this amount of money is something that you probably have to spend. The question is, which one do you rather spend on? Do you rather spend on complications, or do you rather spend to reverse your diabetes? If you are one of those, okay, who want to reverse your condition, probably you can just put there, just put there reverse, okay? Let us know that you are actually serious about it, that you know that now after understanding about all these complications, you really want to try your level best to prevent, and therefore you rather spend the money to reverse rather than to treat complications. Okay, let's move on while we wait for the answer. Come.
Right.
So
So
yeah,
can medication and insulin prevent the complications of diabetes? For those for those of you who are taking medications or insulin injections, what do you think about this statement? Can these medications that you are taking, okay, you swallow it every day, and also insulin, prevent the complications that I've just mentioned just now? If you think that 5 is yes and 6 is if you think yes, then you can type 5. If you think no, then you type 6.
yep.
Okay. So
Okay.
yeah.
Since we know that complications are so scary, right? So the next question comes is this lah. Do you think the medications that was prescribed to you, or insulin, or even the supplements, are those useless supplements that was prescribed to you, right, can actually prevent the complications of diabetes? Because I'm pretty sure when they are being prescribed to you, right, I'm very sure that your doctors were told you, hey, please, you have to be disciplined taking medication and insulin so they can prevent the complications. Is that the truth or is that a lie? Okay, so do you think it can prevent? If you think it's yes, please comment 5. If no, please comment no. Okay, while waiting for the answers, let's proceed. Okay, because we don't have time to, let's go on. We're going to look into one clinical study. This is a very huge clinical study, okay, done on 10,000 patients, diabetic patients. It was done in Canada plus US, these two countries, okay? And do take note, this study was published in year 2008, okay? If you look back, it was published in 2008. That means this clinical study was done in the year of 2005, okay? So it took about 3 years, okay, to complete, and then after that, of course, to publish the paper. Okay, let's check out what happened. They have divided these 10,000 patients into two groups. The first group are those who receive standard therapy. Standard therapy means standard dosage of medication and insulin. Therefore, you notice the blood sugar is still pretty high. The HbA1c is actually up here about 7.5, still high. Then the next group, the next 5,000, you know what they did? They intentionally increase the dosage of medications and insulin. So they bring it up so that the blood sugar drop. And then therefore you see the HbA1c for these patients, right? They're actually lower. You see the lighter dots, right? They're actually lower. They are called the intensive therapy group. Two groups, right? So what they realize in this clinical study, what they realize, let's check out this one. Okay, on this particular graph, is death from any cause. The standard therapy, you notice, is actually lower. The darker dots correlate with the darker line. It's actually lower. But those who receive intensive therapy, right, wow, it's actually higher. Isn't it a bit surprising? Yeah, meaning to say, anyone who's on intensive therapy, right, treatment, right, they're actually more likely to die. And this is a secret we want to reveal to every one of you now, today. Okay, let's check out. Which is, intensive treatment causes more death by a whooping 22%. That means to say, you are taking more medications, you're taking more insulin, you try to bring down your insulin, your blood sugar level, right? Wow, let's say your blood sugar level is beautiful, okay? Your HbA1c is 6.0, or like, wow, your doctor say, so good, so good. Do you think you are in safe hands? Yeah, you are not. Do you know that this clinical study was ended 18 months before the check time? Because they realized that it was unethical for them to continue this test. Why? because too many people die. Because when they increase the dosage of medication insulin, they notice more people died. So they got no choice because they found that it was unethical. They have to stop the clinical study. And they published this paper back in 2008. Question now, why is the treatment causing more death? Yeah. Okay. Because of time factor, I don't know whether I want to share, why is the medications that you're taking is causing more death. If you really want to know at this point of time, okay, please put a Y. Okay, please put a Y. If you can gather 20 Ys, okay, 20 Y means yes, you want to know why is the medication and insulin causing more death, okay, rather than helping you. Please put a Y. Once we gather 20 Ys, then we will explain this. But ladies and gentlemen, the secret that we just revealed to you just now, okay, so turn back to the secret just now. Think about it. Do you even think that your doctor who prescribed medication and insulin to you will actually tell you this? Isn't this one of the secrets that your doctors will not share with you? You just think about it. It's going to be so stupid if the doctor share this with you. It's like, you know what? Oh, Mr. So-and-so, let's say, Mr. Simon, so, you know what? If you take this medication, you're going to die faster, It's just too funny, right? It's just contradicting itself, right? Your doctors will never share this with you. But this is a clinical study that was already done in 2005, published in 2008. We are talking about 13 years ago. It was 13 years ago that we already found out if you are on medications, it's not going to help you. Wow, we have so many why. There are so many whys, right? Yeah. So let me share now. You want to know why medications causes more death? Let's look at this. Okay, we all know sugar is bad for us. Sugar is like rubbish. Okay, so ladies and gentlemen, if you have rubbish in your kitchen, what are you going to do? Are you going to throw it outside of your house, or you're going to throw it? Let's say you have an empty bedroom in your house, and you decided, hey, I got empty bedroom now, huge space, got some wardrobe and things like that. I can throw the rubbish into that bedroom instead of throwing outside of my house. What's going to happen?
Oh.
So you and I know this is a very foolish thing to do. It's a very stupid thing to be done. Nobody throws rubbish into your own bedroom, right? You will always throw it outside, right? So now coming back to taking medications and insulin. So initially, this sugar is inside your blood vessel. So you started taking insulin, you started taking these medications or whatsoever, these oral hypoglycemic agents or whatever. Okay, and these medications and insulin, where are they pushing your sugar to? Are they pushing the sugar out of your body, or they are still inside your body? I think you guessed it right. It's inside your body. The sugar has been transferred from your blood vessel, pushed into your liver. That's why you have fatty liver. Pushed into your pancreas. That's why your pancreas, is being congested. It's pushed into your brain. It's pushed into your heart. It's pushed into your kidney and everywhere. Now you know why. Okay, so sooner or later, this sugar is going to, of course, cause inflammation in all these organs, and your whole body is rotting. Just like how in this particular picture, when you keep pushing all this rubbish into your room, your whole house is going to rot. It's going to stink. Now you know why, despite of how disciplined you are in terms of taking medication and insulin, you notice it will never help you. In fact, the more you take the medications, the worse it becomes. And there are also many supplements out there which is like that. I just cannot stop. I just find this kind of there's this advertisement that is so funny, Yeah, okay. It takes an old man. There was an old man. I'm pretty sure many of you have also seen this advertisement. Okay, if you've seen this after this, probably you just put Y. Just put a Y. Just put a Y. Okay. You know what they did? They take an old man. Okay, and of course they say the old man is diabetic, okay. And they just take the blood sugar. Okay, then after that they drink something. Which is what they sell, the supplements that they sell. Okay, it's like a form of tea or something like that. They drink, and then after that the patient started eating durians. Okay, I think I remember there was one advertisement that is on durian. The other advertisement is on, I think, on some burger or something like that. Oh, the patient just eat it, and after that the test of sugar is normal. Wow, so happy, right? Come on, you know how stupid is that? You're pushing the sugar into your own body cells. How do you even think it can help you? All right. So, ladies and gentlemen, now you know why. Okay. Now you know why. Now you know why taking medication is so bad. Yeah. Someone is asking, just come to the point. Ladies and gentlemen, every single thing that we share in this talk is a point. If you miss any of the point, you won't get the point. right? Because everything is a point. Because why? We believe in using education to empower you. So if you miss one part and you think that this is not a point, you will miss the entire thing. Okay, so every single thing is a point. All right. Can I just go to my medical school and tell myself, oh, I'm a very clever boy, you know? Can I just do the later four years of my medical study? I want to skip 1 year. You know, medical fee is so high, you know. I mean, even medical school fee is so high. You know? I want to skip 1 year. Can I? No, because the entire journey is important. The same goes to our talk. When we share from our heart. Okay, and we want you to know every single point is a point. Okay, so now, ladies and gentlemen, do you now know why medication and insulin is so bad? And if you still continue to take, okay, and of course, you cannot remove it on your own, you need professionals to help you, okay? But if you don't take any action to get professional help, there's, okay, nothing is going to change, okay? You are just rotting away.